I'm starting to see in the ER the effects of all of the fear and anxiety about coronavirus on my patients, on people. And I'm going to tell you a story that I had the other day in the ER. I had a patient come in, a woman in her early 20s, who had a full-blown panic attack because of the news around coronavirus. So she started reading, so she had a history of depression, anxiety. She started reading through headlines over and over, couldn't stop. It was obsessive. She couldn't sleep that night. And by the morning, had worked herself up into where she had a full-blown panic attack. She was in tears, writhing on the bed. She was incredibly uncomfortable. Took a while for her to calm down. She was fine. Her body ended up calming down. It was totally a panic attack. But I looked at this and I was like, this is one of the consequences of what's going on right now in the media and all of the fear and everything. There are people with anxiety, depression all throughout the country. I think most of us can feel that we're on edge. We're kind of hyped up and afraid of this thing. I'm convinced that increased stress is going to translate not only to panic attacks, but maybe even heart attacks. So how can you feel better and feel safe in the middle of the coronavirus? How can you calm down in the middle of all this corona anxiety? So I'm going to give you 3 tips right now. Number 1, stop reading the headlines and watching the news, including this right now. I think the news is what it is. They get eyeballs on things based on fear. I know we want to stay abreast, we want to know what's going on, but really try to limit that, especially if you're somebody who it's going to work you into anxiety, like this patient of mine. She's somebody that just needed to get that out of her life. Number 2, is number 1, check in with yourself. Are you on edge a little bit more? Are you feeling more adrenaline in your system? Are you kind of more poised to respond to a threat, even though it's not imminent, around you? Take your own temperature, so to speak, about your anxiety level. And then I would ask you, how do you relax? What do you do to relax? Go for a walk, exercise, talk to somebody, change your location, get good sleep. Factor in all of these things. This is part of taking care of yourself. It's taking care of your mental health in a time where there is a collective anxiety that I think most of us feel. And then the third thing is, know that we're going to be okay. We're going to get through this, I promise. Some people are going to get sick. We know that there's going to be more cases. The weakest among us are vulnerable. We're going to talk about doing what we can do to help them not get sick. It's just the basics. Don't wash your hands. It's just the basics, like wash your hands. Don't go to where that disease is. And if it's circulating in your community, avoid it. Avoid those places. So do what you can do, and then rest assured we're going to be okay in this. This is not the viral apocalypse. It is not going to take us down. All these initial numbers of this 3 and 5 and whatever percent death rate, it looks like they're much lower than 1%, maybe even 0.6%, maybe even 0.1%. So many people, over 80%, barely even have symptoms, have mild disease, especially if they're young and healthy. Older folks need to protect themselves, get a pneumonia shot, get a flu shot, all that stuff. So those 3 things: cope with your own anxiety. 2, check in, see how you are doing with this. And 3, know that we're going to be okay, and do what you can to, do your part to take care of yourself and the rest of the community.